Peace. Welcome to the YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm your moderator and narrator, Uriel Riley. Hi, it's Hartwell. We pick up in chapter 5 on page 111 in the middle. Title volume. This is awesome. Peace, peace, everyone. All right, so title volume. Chapter 5, Clinical Evaluation of the Pulmonary System. Page 111. With a regular breathing pattern, 10 breaths are measured and the measurement divided by 10. The measurement must be made for 1 full minute and then divided by the ventilatory rate if the pattern is irregular. The measurement can be made easily in the comatose patient. Minute volume. Minute volume can be readily obtained by measuring the tidal volume and multiplying by the ventilatory rate. FVC. Forced vital capacity. FVC. Forced vital capacity is an important measurement in the estimation of ventilatory reserve. The measurement depends on the cooperation of the patient and therefore is not obtainable in a semi-comatose, or uncooperative patient. The patient is instructed to take the deepest inspiration possible and then, with the spirometer attached, exhale the air as quickly, forcefully, and completely as possible. Success in obtaining an adequate forced vital capacity at the bedside can be achieved if you fully explain what you want the patient to do and how important it is that he make or she make a maximum effort. The maneuver should be done at least 3 times and the best effort recorded. Since we are concerned with the patient's ability to meet stress by increasing his ventilatory work, the forced vital capacity is far better reflection of ventilatory reserve than the slow vital capacity. Meeting stress means that the ventilatory system must work at a greater energy cost and therefore must be working under forced conditions. Peace, highest heart love. Thank you for being here. Peace, peace. Thank you for reading books with us. Happy Saturday. We are moving on to page 112. We are in the section of Foundations of Respiratory Care, Chapter 5, Clinical Evaluation of the Pulmonary System. Thank you for the likes and subs. We are pushing the 500 subs on this wonderful, peaceful channel where we read books and learn from masters. So, highest heart love. All right. Negative inspiratory force, NIF. Yes, we're reading. That's right. We're reading master material. This is MCAT material to become a doctor. So, thank you so much for being here. We're giving it away for free. Negative inspiratory force. Estimation of ventilatory reserve is necessary in most patients when forced vital capacity measurement is not obtainable. A reasonable substitute measurement is the negative inspiratory force, NIF. Experience has shown that the muscular power needed to provide a vital capacity of approximately 7 milliliters per pound, 15 milliliters over kilograms, produces a negative inspiratory force of greater than negative 20 centimeters of water in 20 seconds. The normal NIF is in excess of negative 80 centimeters of water. The equipment needed for this measurement is a manometer that will measure negative pressures and an adapter for connection to the anatomic mask or artificial airway. The manometer is attached and completely occluded for a period of 10 to 20 seconds while the inspiratory efforts of the patient are noted. Any degree of obvious distress or changes in vital signs calls for the immediate abandonment of the procedure and the reestablishment of a patent airway. Peace, peace. Hi, it's Heart Love. Welcome, YouTube. We're reading books, masterful books. This is Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. For all those aspiring to take the MCAT. That's the work we're doing here on this channel, reading books. Thank you so much for being here. Down in the middle of page 112, clinical interpretation. The clinical significance of such measurements depends primarily upon the experience and training of the practitioner and the patient. Clinical guidelines established over the last 15 years have proven reliable as aids to clinical judgment. They must never be considered absolute. 1. Normal tidal volume is 6 to 7 milliliters over kilograms, 3 to 4 milliliters per pound of normal body weight. 1 milliliter per pound is anatomic dead space. 2. A decreased tidal volume usually means the presence of restrictive disease, central nervous system depression, or decreased ventilatory reserve. 3. The adult ventilatory rate is normally 12 to 18 per minute. Slow ventilatory rates, bradypnea, usually reflect severe central nervous system disease or narcotic overdose. Increases in ventilatory rate usually indicate decreased ventilatory reserve or hypoxemia, a acid-base imbalance, or CNS disease. 4. Minute ventilation is normally between 5 and 10 liters per minute in the adult. This measurement gives us a general reflection of individual's total mechanical ventilation and may be used in conjunction with blood gas measurements to indicate the efficiency of physiologic gas exchange. See Chapter 19. 5. The force vital capacity is used primarily as a reflection of the patient's ability to breathe deeply and cough. Experience has shown that the previously non diseased patient must have a vital capacity of at least 15 milliliters over kilograms to assure that he can or she can breathe deeply and cough effectively. And six, that's why I'm reading it for you guys. If you're not strong readers, you don't have a great vocabulary, we can dive into this with me and all the other books on the channel. That's why we put them on the playlist, because I do have the vocabulary. I do have the experience to give you this information and wisdom. So thank you for reading with us. Thank you for tagging along. Thank you for liking and subbing and just being a part of a peaceful channel. Thank you so much. Really, really, highest heart love. All right, we're at the top of page 113. Thank you. Oh my goodness. Highest heart love. Thank you so much. Yes, that's what we're reading it for you. We're giving it to you for free. This is thousands of dollars of information and, you know, to test on. So we're giving it to you for free all on this channel. You can just click on one of the playlists and read the entire book. Gratitude and highest heart love. Arterial blood gases. Unquestionably, the most important single factor in the development of clinical respiratory care has been the clinical availability of blood gas and pH measurements. These are essential tools to the respiratory care practitioner and are important to him as the electrocardiographic monitor to the coronary care nurse. One cannot be involved in respiratory care without an ability to evaluate and assess arterial blood gas measurements. The greatest confusion surrounding blood gas measurements stems from the fact that the few people understand what is being measured and what the measurement reflects. Several textbooks and monographs are available concerning the use and interpretation of arterial blood gases. Respiratory care practitioners must establish a working relationship and familiarity with these measurements since it is impossible to clinically apply respiratory care without clinically applying blood gas measurements. The partial pressures of arterial oxygen and carbon dioxide have no direct quantitative relationship with arterial content of carbon dioxide or oxygen. The arterial pH measurement is one of hydrogen ion activity. In the middle of page 113, of clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Yes, yes. Thank you so much. I said I'm the best reader on YouTube. Awesome. Thank you so much. Man, that's love. I like to think so. That's why I came on here reading these books because it was like, this is what I can help so many people with and reach so many people with is just reading to them information that they can use in their life and you know that I've used in my life in my practice. And so my modalities are gifts to the world to be able to help to heal people. And that's why I like to think books are as well. They give us introspection on how other people came up with the ideas that they have. So if you're not a strong reader, it's okay. You know, that's why I'm here to read it to you and read it for you. And then you assimilate it into your life. You master it on your time. Thank you so much for being here. This is so powerful. Thank you for the likes and subs. We are pushing towards 500 in this peaceful place on YouTube where we read books and learn from masters. I'm Master Fitness Trainer Uriel Riley. Thank you so much. PCO2 in the middle of page 113. The measurement of the partial pressure of carbon dioxide, PCO2, in the arterial blood is a direct reflection of the adequacy of alveolar ventilation. The only non metabolic factor that affects the moment to moment level of arterial PCO2 is the efficiency with which the lung exchanges air with blood. This efficiency of exchange, balanced against the metabolic rate that is producing carbon dioxide, will determine the arterial PCO2. In other words, adequate physiologic ventilation may be defined as an arterial PCO2, where significantly in the normal range. Inadequate physiologic ventilation would be an arterial PCO2 above normal, a condition referred to as ventilatory failure or respiratory acidosis. On the other hand, if the arterial PCO2 were significantly below normal, it would signify physiologic hyperventilation, a situation referred to as alveolar hyperventilation or respiratory al- alkalosis. alkalosis. The major significance of the arterial PCO2 measurement to the respiratory care practitioner is that it is an immediate measurement of the adequacy or inadequacy of physiologic ventilation. Top of page 114. The arterial pH is a measurement of the free hydrogen ion concentration in the arterial blood. This measurement has a twofold clinical application. One, the pH is a reflection of the total acid base balance of the body and an excellent indicator of tissue milieu. And two, a sudden significant change in the arterial carbon dioxide tension must chemically affect pH. Over a period of hours or days, the kidneys will compensate for acid base change. Therefore, a PCO2 change that is accompanied by a normal pH signifies that the ventilatory event is not acute. Whenever a PCO2 change is accompanied by a concomitant pH change, it must be assumed that the ventilatory change was of recent onset since it is uncompensated. It is important to recognize the suddenness or acuteness of a ventilatory change because the direct threat to life is not only the degree of abnormality of ventilation, but also the rapidity of change in ventilatory status. The arterial PCO2 and pH measurements give the respiratory care practitioner a physiologic reflection of the ventilatory and acid base status. So much for being here and reading with us. Hi, it's Heart Love. Thank you so much. Peace. Oh, thank you. Yes, all our family and friends. That's what we're reading this for, to help them and also to be able to give them care if we need to. This respiratory care. We're coming into where we're talking about the venous oxygen, the VO2 max. And this is how we train athletes to get better endurance wise, is tracking this. And so this all deals with your blood flow levels. So respiratory care is just life-saving, life-changing. That's why I decided, let's read this $3,500 book to the people. We manifested this together. This information is vital to helping others. So thank you so much for being here. And for anyone aspiring to take the MCAT, we're here for you. You'll be able to read all of the entire book, just like the other ones on this kind of channel. You just go click on one of the books in the playlist, and it will play the entire thing of me reading it with you. So, hi, it's Heart Love. The arterial PO2. The arterial PO2 is a measurement of the dissolved oxygen gas tension in the arterial blood. This is closely related to the saturation of the hemoglobin with oxygen and therefore the oxygen content of arterial blood. The arterial PO2 is an extremely important measurement. However, it must be remembered that the measurement does not reflect the tissue oxygen state. See Chapter 6. Blood gas measurements reflect the status of cardiopulmonary homeostasis and are therefore most useful in the critically ill or pulmonary diseased patient. The sicker the patient, the more frequently blood gas measurements are needed. A complete discussion of blood gases is outside the scope of this text. However, the reader is encouraged to study the subject in depth. No other single factor is more important to respiratory care. La 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 la. We did it! We completed another chapter. Chapter 5 is complete. Yes, yes, we're doing it. We are reading doctor books here, live from the light, live from LA. So, next chapter, we go into section 2, oxygen therapy. Section 2, we completed section 1, yes, yes, of clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Thank you so much for being here and reading with us. We completed another chapter right on time. I want you to have a wonderful, wonderful Saturday, divine rising. What a beautiful rest and dream world we had last night. Oh my goodness. Thank you so much for reading books with us. Oh, peace, Linda. Maze. Oh my goodness. We're family. Maze. I'm related to the Mazes as well. We probably both related to, oh man, the Mazes in South Jersey. That's how I'm related to Willie Mays. Hi, it's Heart Love. Thank you for reading books. Love to all the practitioners of health and medicine and respiratory care. We are reading it on this channel. Just had a wonderful, magical session because I'm a Your Healing practitioner, and which is diaphragmatic breathing with assisted stretching and pressure points to the hands and to the feet. And I was working with a stroke patient the other day, and their arm was locked up way up here when I saw them, right? And at by the end of the session, after I did the pressure points to the hands and stretch his arms and biceps and latimus dorsi, and I was relieving pressure points all through the forearm and on the side and the tricep and the deltoid, just releasing all of it, right? And his arm at the beginning was locked up here. By the time he was done, after his breath work, he did over 400 diaphragmatic breaths. His arm was laying down here on his leg. It was just so awesome, and that's what we have to do: teach and send people out into the world with the information to be able to be successful as well as heal themselves. That's what this channel is for. That's why we bring you live from the light, reading books in peace. Hi, it's Heart Love. Shaking it up in the world, reading books on YouTube. Thank you so much, YouTube. Here's some love water to everyone. Wishing the best, that you have a wonderful day. Seni Señores. Event. Oui, bonjour. Dankeschön. Mm, mm. So good. I love you. I love you. I love you. Thank you so much for reading books with us. Have a wonderful day. I will see you soon, okay? Peace. Thank you, bro. Oh, say thank you, brother. Thank you, Jake. Jake the Snake. Highest heart love. We are reading masterful books on here. Thank you for being a part. Thank you for the likes and subs. I will see you soon, okay? I love you. You. I love you. Peace. Happy Saturday. Thank you for being honorable in the Imbangi, like Dr. Greg Carr says. Thank you so much. Peace.